the worst medication that destroys your brain over time. You might be destroying your brain without even realizing it. With every pill you take, your memory could be unraveling, your focus dwindling, and your risk of dementia increasing. Common medications widely prescribed are quietly sabotaging your cognition. Medicines for anxiety, insomnia, high blood pressure, and even migraines could be compromising your brain functions in the long run. But no one tells you this. In this video, you'll discover which medications might be undermining your intelligence, your mental clarity, and even your learning ability. And at the end, the most important information of all, the worst medication among them all, the one that has the most devastating effect on the brain. Perhaps you or someone in your family is taking this medication right now without any idea of the danger. If you care about your mind and want to avoid cognitive decline, you need to watch this video to the end. What you discover here could save your memory and your future. So join me. Number 13. Tricyclic antidepressants. First of all, I want to emphasize the following. Do not self-medicate. And also do not take medications without the guidance of a doctor. The medications that will be mentioned from here on are sensitive. Both their use and discontinuation should be done under strict recommendation of a health professional. And why am I saying all this? Because these are serious medications that can really affect your brain in various ways. Tricyclic antidepressants, such as amitriptyline, nortriptyline, and imipramine, were widely used in treating depression before the advent of newer classes of medications. Despite their efficacy in treating mood disorders, these drugs present a serious problem: their side effects on the brain. They affect neurotransmitters essential for cognition, such as acetylcholine, and can directly impair memory, attention, and the speed of reasoning. Especially the elderly and those who use them for an extended period are more vulnerable to the neurological damage of these medications. The most concerning impact of tricyclic antidepressants is called cholinergic dysfunction. This class of drugs blocks the receptors of acetylcholine, a neurotransmitter essential for forming new memories. When this blockage occurs for a long time, the brain begins to have difficulties in processing and storing information, which can result in memory lapses and a reduction in learning capacity. Studies show that patients who use tricyclics for extended periods have an increased risk of developing dementia and neurodegenerative diseases. Besides cognitive problems, these medications can directly affect sleep quality, causing excessive sleepiness during the day and impairing the natural sleep cycle. Often, the patient enters a vicious cycle, uses the tricyclic antidepressant to improve mood, but ends up suffering from mental fatigue and focus difficulties, which compromises their quality of life. This relationship between depression and cognitive decline can intensify over time. The effects of tricyclic antidepressants are not limited to the mind. These medications can also affect the cardiovascular system, causing blood pressure drops and increasing the risk of dizziness and fainting. This is especially dangerous for the elderly, who already have an increased risk of falls and fractures. Additionally, urinary retention and constipation, two common effects of these drugs, can also be signs of a profound impact on the body's neurotransmission. The fact that these medications are prescribed for different conditions, such as chronic pain and migraines, further increases the number of people exposed to these risks. With advances in medicine, new, safer options have emerged to treat depression and anxiety disorders. Selective serotonin reuptake inhibitors, for example, have fewer cognitive side effects, although they can still affect the mind in other ways. The problem is that many doctors continue to prescribe tricyclic antidepressants for different conditions without considering their long-term impacts. For those already using them, it is essential to seek medical advice to evaluate the need to continue the treatment or seek less harmful alternatives. If you are concerned about the health of your brain, it is crucial to be aware of everything that can affect it, and medications are a key piece in that puzzle. Consult a doctor if in doubt. Number 12. Antipsychotics. Antipsychotics such as risperidone, olanzapine, and quetiapine are essential medications in treating severe psychiatric disorders such as schizophrenia and bipolar disorder. However, their impact on brain function is profound and often devastating. These drugs act by blocking dopamine receptors, a crucial neurotransmitter for motivation, memory, and learning. The problem is that this interference can result in a state of mental slowness, difficulty reasoning, and even dementia-like symptoms over the long term. Although they are essential for certain patients, the indiscriminate use of these medications can compromise the quality of life and cognitive function irreversibly. The blocking of dopamine by antipsychotics affects not only mood and motivation, but can also severely impair concentration ability. Patients on long-term treatment often report a foggy mind sensation, where simple tasks become difficult and the response to external stimuli slows down. This happens because dopamine plays a crucial role in neuron communication, and its inhibition impairs brain plasticity. This effect is particularly concerning in the elderly, as it can accelerate cognitive decline and increase the risk of neurodegenerative diseases, such as Alzheimer's. Another alarming side effect of antipsychotics is the development of motor symptoms similar to those observed in Parkinson's disease. This occurs because by blocking dopamine, these medications compromise the functioning of the basal ganglia, a brain region responsible for controlling movements. In the long term, this effect can become permanent, leading to tremors, muscle stiffness, and motor difficulties that do not disappear even after the medication is stopped. This type of neurological damage can be irreversible, making these medications a risky choice for continuous use, especially when safer alternatives are available. Many doctors prescribe antipsychotics not only for severe psychiatric disorders but also for cases of insomnia, anxiety, and even treatment-resistant depression. This off-label use can expose millions of people to unnecessary risks without their awareness of the possible side effects. Before starting treatment with antipsychotics, it is essential to consider all available alternatives and carefully evaluate the benefits and risks. Number 11. Migraine medications. Migraine medications, especially topiramate, are widely used to prevent crises and reduce the frequency of intense pain episodes. However, few people know that this medication can have severe side effects on the brain, directly affecting memory, concentration, and mental processing ability. Topiramate works by reducing the excitability of neurons, which helps prevent epileptic seizures and migraines, but this reduction in brain activity can lead to a state of constant mental confusion. Many patients describe the sensation of being disconnected, having difficulties remembering simple words, and performing tasks that previously seemed easy. One of the most reported side effects by users of topiramate is the so-called brain fog. This means that the person feels a mental block, as if their ability to think clearly is reduced. This symptom can be especially harmful to those working in areas that require quick reasoning and sharp memory. In addition, the slowing of cognitive processing can make learning more difficult, impairing the retention of new information. For students and professionals who need to be always alert and productive, the continuous use of this medication can be extremely problematic. Another serious issue associated with topiramate is its interference with language. Some patients report that they begin to forget common words or have difficulties forming sentences correctly. This effect occurs because the medication alters communication between neurons in the cerebral cortex, the area responsible for language and cognition. This impact can be temporary for some people, but in cases of prolonged use, recovery can be slow and incomplete. The impairment of verbal communication can significantly affect social and professional life, making everyday interactions more challenging. In addition to cognitive problems, topiramate can affect mood and emotional stability. Reports indicate that the medication can cause episodes of apathy, anxiety, and even depression. This effect can be particularly dangerous for people who already have a history of emotional disorders, as it may intensify pre-existing symptoms. The combination of mental fatigue, language difficulties, and mood swings can result in a drastic reduction in quality of life, making the benefits of the medication for migraines not justify the damage caused to the brain. The decision to use a medication like topiramate should be made with caution, considering both the benefits and the risks. Number 10. Muscle relaxants. Muscle relaxants such as cyclobenzaprine, carisoprodol, and methylcarbamol are often prescribed to relieve muscle pain, spasms, and discomfort resulting from injuries or chronic conditions. However, few people know that these medications act directly on the central nervous system, depressing brain activity to produce a sensation of relaxation. This means that in addition to relaxing the muscles, they can also slow down mental functioning, resulting in drowsiness, difficulty concentrating, and even long-term memory impairments. For those already suffering from cognitive problems, the continuous use of these medications can accelerate brain function decline. Cyclobenzaprine, one of the most commonly used muscle relaxants, shares chemical similarities with tricyclic antidepressants, which have already been mentioned in this video. This means that it can also affect the levels of neurotransmitters essential for cognition, such as acetylcholine and noradrenaline. Over time, this can lead to episodes of mental confusion, difficulties in processing information, and a sensation of foggy mind, especially in the elderly. These effects are even more intense when muscle relaxants are combined with other medications that depress the nervous system, such as benzodiazepines and opioids. Another serious problem associated with muscle relaxants is the risk of dependence. Carisoprodol, in particular, is known for its addictive effects, leading to misuse and progressive tolerance. This means that, over time, the user may need increasingly larger doses to achieve the same relaxing effect, increasing the risks of excessive sedation and mental impairment. In addition, continuous use can make the brain dependent on this medication to maintain a state of calm, making it difficult to stop the treatment and exposing the patient to severe withdrawal symptoms. Muscle relaxants can also affect sleep quality, especially when taken at night. Although they can induce deeper sleep, they impair the natural sleep cycles, leading to less restorative awakening. This can result in daytime fatigue, memory lapses, and difficulty concentrating throughout the day. In addition, these medications can impair reflexes and motor coordination, increasing the risk of falls and accidents, especially in older people. The combination of these factors makes prolonged use of these drugs a risk to cognitive function. Many doctors prescribe muscle relaxants without warning patients about the long-term side effects. For those who need to relieve muscle pain, there are safer alternatives such as physical therapy, therapeutic massages, and stretching techniques. Occasional use can be helpful, but when these medications are taken continuously, the damage to the brain can be significant. Before resorting to these drugs, it is essential to consider all available options to avoid cognitive impairments that may become irreversible. Number 9. Corticosteroids. Corticosteroids, such as prednisone and dexamethasone, are powerful medications used to treat inflammations, autoimmune diseases, and even severe respiratory conditions. Although they are extremely effective in controlling inflammation, these drugs can also have a worrying impact on the brain. This occurs because corticosteroids directly affect cortisol levels, an essential hormone for the stress response. When used for long periods, these medications can alter the functioning of the central nervous system, causing memory problems, concentration difficulties, and even mood changes. Excess cortisol in the brain can be extremely harmful. This hormone, when elevated for a long time, can cause direct damage to the hippocampus, the region of the brain responsible for memory and learning. Studies show that patients who use corticosteroids for extended periods have an increased risk of developing cognitive deficits and even dementia-like symptoms. This occurs because excess cortisol can lead to neuron death, reducing the brain's ability to form new connections and process information efficiently. In addition to memory problems, corticosteroids can cause mood and behavior changes. Patients using these medications often report episodes of anxiety, irritability, and even depression. In some cases, corticosteroids can induce psychotic symptoms, such as hallucinations and delusions, especially at higher doses. These changes in brain function can impair the patient's quality of life and make treatment with these medications a real challenge. Another worrying effect of corticosteroids is the impact they have on brain structure. Research indicates that prolonged use of these drugs can lead to a reduction in brain volume, particularly in regions associated with emotional control and decision-making. This means that people who use corticosteroids for long periods may have more difficulty handling stress situations and an increased risk of developing psychiatric disorders. The connection between these medications and cognitive decline is something that deserves much more attention than it currently receives. Despite the risks, corticosteroids continue to be widely prescribed for a variety of medical conditions. To minimize brain damage, it is essential to use them for the shortest possible time and under strict medical supervision. Number 8. Statins. Statins such as simvastatin, atorvastatin, and rosuvastatin are widely prescribed to reduce cholesterol levels and prevent cardiovascular diseases. However, few know that cholesterol plays a crucial role in brain function. It is one of the main components of neuron cell membranes and is essential for neurotransmitter production. By aggressively reducing cholesterol levels, statins can compromise neuron communication and negatively affect cognition. Studies indicate that patients who use statins continuously may have a higher risk of memory lapses, concentration difficulties, and even accelerated cognitive decline. This occurs because cholesterol is also necessary for forming synapses, the connections between neurons that allow learning and information retention. When cholesterol levels are drastically reduced, the brain may have difficulty maintaining these connections, resulting in cognitive impairments that may become permanent. Another concerning factor is that statins can reduce coenzyme Q10 levels, a substance essential for energy production in brain cells. The deficiency of this coenzyme can lead to mental fatigue, lack of clarity in thoughts, and a constant feeling of tiredness. Additionally, research suggests that prolonged use of statins may be linked to an increased risk of developing neurodegenerative diseases, such as Alzheimer's and Parkinson's, due to their interference with mitochondrial function. While statins are effective for controlling cholesterol, not all patients need them in the long term. In some cases, dietary and lifestyle changes may be safer alternatives to maintaining cardiovascular health without compromising brain function. Before starting or continuing the use of these medications, it is essential to discuss the risks and benefits with a qualified health professional. Number 7. High blood pressure medications. High blood pressure medications, especially beta blockers like propranolol and metoprolol, are essential for millions of people who need to control hypertension and prevent serious cardiovascular diseases. However, what many do not know is that these medications can directly affect brain function, reducing oxygenation and altering neurotransmitter activity. Although their primary function is to reduce the load on the heart, they also slow down the activity of the nervous system, which can result in mental fatigue, concentration difficulties, and even episodes of depression. The brain depends on a constant and well-regulated blood flow to function correctly. When beta blockers reduce blood pressure, they also decrease the amount of oxygen and nutrients that reach the brain. This effect can be beneficial in some medical conditions, but in the long term, it can lead to concerning cognitive symptoms. Patients who use these medications often report a sensation of mental slowness, where reasoning becomes slower and responses to external stimuli seem less agile. For some people, this effect can be so intense that it compromises daily activities such as work and learning. Another factor that exacerbates the impacts of beta blockers on the brain is their interference in the regulation of adrenaline and noradrenaline. These substances are crucial for maintaining alertness and the ability to respond to stress situations. When their production is inhibited by medications, the patient may experience a constant feeling of tiredness and lack of motivation. Additionally, there are reports that these medications can decrease the brain's ability to form new memories, making learning and information retention more difficult over time. While it is essential to control blood pressure, especially to prevent strokes and heart diseases, it is important to be aware of the possible side effects of these medications. For those who need to continue treatment, it is essential to discuss with a doctor strategies to minimize the negative impacts on cognition. Number 6. Anticonvulsants. Anticonvulsants such as valproic acid, phenytoin, and carbamazepine are widely used to treat epilepsy, bipolar disorder, and even chronic pain. Although they are essential for many patients, these medications have a direct impact on the brain's electrical activity, reducing its excitability. The problem is that, in doing so, they can also impair cognitive function, affecting memory, attention, and learning ability. For some people, the prolonged use of these drugs can result in mental difficulties so severe that they affect their quality of life irreversibly. The brain depends on a delicate balance between excitation and inhibition to function correctly. Anticonvulsants work by increasing the action of the inhibitory neurotransmitter GABA or reducing excitatory signal transmission. This is crucial for controlling epileptic seizures, but can also lead to a generalized reduction in brain activity, resulting in mental slowness and concentration difficulties. Patients who take these medications for long periods often report problems such as forgetting simple tasks, difficulties expressing themselves verbally, and a persistent sensation of a foggy mind. Another problem associated with the continuous use of anticonvulsants is their impact on neuroplasticity, i.e., the brain's ability to adapt and form new connections. This is especially concerning for young or elderly patients who need efficient brain activity to continue learning and processing information adequately. In some cases, the cognitive effects of these medications can be so significant that patients need to discontinue treatment or seek less harmful alternatives. In addition to the impact on memory and learning, anticonvulsants can also affect emotional balance. Some drugs in this class are associated with an increased risk of depression and even suicidal thoughts. This occurs because they interfere with neurotransmitter systems that regulate mood and motivation. For people who already suffer from depressive disorders, the prolonged use of these medications can exacerbate symptoms and make daily life more challenging. Despite the risks, anticonvulsants remain fundamental for many patients. However, it is essential that anyone using these medications be aware of the possible side effects and work together with a doctor to monitor their cognitive health. In some cases, dosage adjustments or lifestyle changes can help minimize negative impacts. Always under strict medical guidance, of course. Number 5. SSRI antidepressants. Selective serotonin reuptake inhibitors, or SSRIs, such as fluoxetine, sertraline, and paroxetine, are the most widely prescribed antidepressants in the world. They are considered safer than the older tricyclic antidepressants, but that does not mean they are free of risks. Their main mechanism of action involves increasing serotonin levels in the brain, which can improve mood and reduce anxiety. However, this chemical change can have unexpected consequences for motivation, memory, and concentration. The increase in serotonin promoted by SSRIs can create an effect of apathy in some patients. This occurs because the balance between neurotransmitters like dopamine and noradrenaline is also affected. Dopamine, in particular, is essential for motivation and the desire for achievement. When the levels of this neurotransmitter are reduced, the patient may experience a state of emotional indifference, where important tasks no longer seem relevant and the sensation of pleasure in daily activities decreases. This effect is known as SSRI-induced indifference syndrome and can profoundly affect the quality of life of those taking these medications. Besides apathy, SSRIs can also affect short-term memory and learning ability. Some research suggests that by altering normal neurotransmission patterns, these medications can make consolidating new memories more difficult. This means that, although the patient may feel less anxious or depressed, they may also have difficulties absorbing and retaining information. This effect is particularly concerning for students and professionals who rely on mental clarity to perform their duties. Another little-discussed aspect of SSRIs is their impact on creativity. Many people who use these medications report a sensation of disconnection from their own thoughts and emotions, which can affect the ability to solve problems innovatively. For those who work in creative fields, this alteration can be especially frustrating as it limits spontaneity and personal expression. Despite these risks, SSRIs are still a very valuable tool in treating depression and anxiety. However, it is essential that patients be aware of the possible side effects and discuss with their doctors alternatives or dosage adjustments to minimize the impact on cognition. Number 4. Proton pump inhibitors. Proton pump inhibitors, or PPIs, such as omeprazole, pantoprazole, and esomeprazole, are widely used to treat gastrointestinal problems like acid reflux, ulcers, and gastritis. These medications work by drastically reducing acid production in the stomach, providing relief for uncomfortable symptoms like heartburn and stomach pain. However, despite their popularity and apparent harmlessness, PPIs can have a concerning impact on brain health. Recent studies have shown that prolonged use of these drugs can increase the risk of cognitive deficits, including memory loss and learning difficulties. One of the main problems related to chronic use of PPIs is vitamin B12 deficiency. Gastric acid plays an essential role in the absorption of this nutrient, which is crucial for the health of the nervous system. When stomach acidity is reduced for an extended period, the absorption of vitamin B12 is compromised, leading to a condition called subclinical B12 deficiency. Symptoms of this deficiency include mental fatigue, concentration difficulties, a sense of confusion, and even more severe neurological symptoms, such as tingling in the extremities and loss of coordination. Besides vitamin B12 deficiency, PPIs can also negatively affect the intestinal microbiome. The gut and brain are closely connected through the so-called gut-brain axis, and an imbalance in the intestinal flora can directly impact brain function. Research indicates that continuous use of proton pump inhibitors can lead to an increase in harmful bacteria in the gut, resulting in systemic inflammations that affect cognition. People who use these drugs for extended periods often report episodes of mental fog, difficulty concentrating, and a persistent feeling of tiredness. Additionally, PPIs can interfere with the elimination of toxic substances from the brain, making the nervous system more vulnerable to the accumulation of proteins associated with cognitive decline. Despite these risks, many people use PPIs daily without medical guidance, believing they are completely safe for prolonged use. Ideally, these medications should be used only when absolutely necessary and for the shortest possible time. There are natural alternatives to reduce acid reflux, such as dietary changes, stress management, and consumption of alkaline foods. Before resorting to continuous use of these drugs, it is essential to seek medical advice to evaluate the real need and explore less harmful options. Number 3. Urinary incontinence medications. Urinary incontinence medications such as oxybutynin and toltrodine are widely prescribed to treat overactive bladder and other urinary problems. Although these drugs can provide relief for those suffering from frequent episodes of urinary urgency, their side effects on the brain are alarming. These medications belong to the class of anticholinergics, which block the action of acetylcholine, a neurotransmitter fundamental for memory, learning, and overall cognitive function. The impact of this blockage can be devastating, especially in the elderly, making these medications one of the biggest risk factors for the development of dementia. Acetylcholine plays an essential role in neuron communication and is directly involved in processes such as forming new memories and controlling attention. When urinary incontinence medications block this neurotransmitter, the effects can be quickly felt: concentration difficulties, frequent forgetfulness, and a persistent sense of mental confusion. The problem becomes even more severe with prolonged use, as the continuous reduction of acetylcholine levels can lead to permanent damage to neural connections, accelerating cognitive decline. Another serious issue related to the use of these medications is their effect on sleep quality. The disruption of acetylcholine can negatively affect natural sleep cycles, leading to insomnia and fragmented sleep. As sleep plays a crucial role in memory consolidation and neuronal regeneration, this side effect can further exacerbate cognitive problems. Many patients who take these medications report an increase in daytime fatigue and a constant feeling of mental exhaustion. Despite the risks, many doctors continue prescribing these medications without informing patients about the brain side effects. For those suffering from urinary incontinence, it is important to consider safer alternatives such as pelvic physiotherapy, bladder muscle strengthening exercises, and dietary changes. In addition, new medications for incontinence that do not have the same anticholinergic effect may be safer options for those wishing to preserve cognitive function. Number 2. Continuous use of antihistamines. Antihistamines, such as ranitidine and cimetidine, are commonly used to treat allergies, gastric reflux, and stomach problems. However, when used continuously, these medications can have a worrying impact on brain health. The reason? They affect the production and action of acetylcholine, an essential neurotransmitter for cognition. Like the medications for urinary incontinence, prolonged use of antihistamines can significantly increase the risk of cognitive decline and dementia. The blockage of acetylcholine by antihistamines can result in a range of neurological side effects, including memory lapses, learning difficulties, and reduced concentration ability. This effect is especially concerning in the elderly, as the brain naturally experiences a reduction in acetylcholine production with aging. The combination of these factors can accelerate the onset of diseases like Alzheimer's and Parkinson's, making these medications a hidden risk to mental health. In addition to the impact on memory, antihistamines can also affect alertness and the ability to respond to stimuli. Many people who use these drugs continuously report a persistent feeling of fatigue and drowsiness, making it difficult to perform daily tasks. This effect can be even more problematic when these drugs are combined with other medications that depress the nervous system, such as benzodiazepines or muscle relaxants. Although antihistamines are considered safe for occasional use, their prolonged use should be avoided whenever possible. Natural alternatives, such as dietary and environmental changes, can help manage allergies and gastric problems without compromising brain health. Before continuing to take these medications daily, it is essential to assess the risks. Trusted and quality doctors will know what is best for you and your well-being. Number 1. Scopolamine. Among all the medications that compromise cognitive function, scopolamine stands out as one of the most devastating. Known primarily for its use in treating nausea, motion sickness, and intestinal cramps, this substance has a direct and profound effect on the brain. Its mechanism of action involves blocking acetylcholine, a neurotransmitter essential for memory, attention, and learning. The result? Intense mental confusion, reasoning difficulties, and in extreme cases, episodes of delirium and hallucination. For those who use this medication continuously, the risk of developing severe cognitive deficits is alarming. The effect of scopolamine on the brain is so powerful that it is often used in scientific research to simulate temporary states of dementia. By blocking cholinergic receptors, this medication causes a temporary collapse in executive functions of the brain, leading to difficulties in remembering basic information, spatial disorientation, and slowness in mental processing. These symptoms can appear soon after use and can persist for hours or even days, depending on the dose. For elderly patients or those predisposed to neurodegenerative diseases, the damage can be even more severe and potentially irreversible. Another worrying effect of scopolamine is its ability to induce extreme drowsiness and mental fatigue. Many patients report a sensation of being disconnected from reality, where simple tasks seem challenging and thinking becomes foggy. This excessive drowsiness also significantly increases the risk of accidents, making activities such as driving or operating machinery extremely dangerous. In addition, when combined with other medications that depress the central nervous system, such as benzodiazepines and muscle relaxants, scopolamine can enhance their sedative effects, leading to an even more drastic reduction in cognitive function. In the long term, continuous use of this medication can have devastating consequences for mental health. Studies indicate that chronic blockage of acetylcholine is directly linked to an increased risk of dementia, including Alzheimer's disease. This occurs because acetylcholine is essential for communication between neurons and the maintenance of brain synapses. When this neurotransmitter is systematically inhibited, the brain's ability to form new connections is impaired, accelerating the process of cognitive deterioration. This effect can be particularly concerning for people who already have a family history of neurodegenerative diseases. Despite the risks, scopolamine continues to be widely prescribed and used without many patients being aware of the damage it can cause to the brain. In many cases, there are safer alternatives for treating nausea and intestinal cramps, such as dietary adjustments, natural therapies, and lifestyle changes. For those already using this medication, it is crucial to talk to a health professional to assess the real need for the treatment and explore less harmful options. Protecting brain health should be a priority, and that starts with making informed choices about the medications we use. So do not take any medication, nor stop taking a prescribed medication without your doctor's guidance and permission. Good professional health guidance will greatly assist you in the battles of your life. And if you want to continue receiving the best videos for your health, subscribe to the channel because it exists for one reason: to make you a healthier person with a better quality of life. Helping you is my mission. In the video that now appears on your screen, I reveal the 6 fruits that cancer fears. Click on the screen and check it out. So until the next video,